Hi, this is Dr. Story. Let's take a second to talk about an insurance alternative called health sharing. Health sharing, you may not be familiar with it, but you may have heard of some of the companies that are involved in it. Samaritan Ministry, Community Health Shares, MediShare, Zion's Health, Solidarity, Sedera. There's a bunch of these out there, and they're really unique in the way that they cover catastrophic care. So first off, if you've been part of our clinic, you know that we cover the basics really well. But we're not an insurance plan. We don't cover you if you end up going to the hospital or you have something really big happen. And we think you need something that brings the two together. Health sharing is a really good alternative to insurance. Insurance has some real downsides. And if you've been part of our clinic, you know that we're not big fans of insurance. It's expensive. It muddles the picture of who's taking care of what. It often means that you're sending your money away to a big company who's making a profit of what you do, which we think is not a really good thing for medicine. Let's talk a little bit about health shares. First off, let me tell you some of the good things that we think come from health shares. First off, they're amazingly cost effective, and I'd encourage you to go looking. Most of them are 50% less than insurance, and that's pretty remarkable when you think about covering the big stuff that you want to make sure you don't get in trouble with. Second is, they really are meant for a specific need, which is a rainy day event, a big thing that interrupts your life. They're not really getting into the mess or the day-to-day stuff that honestly insurance is really bad at, which is where I think insurance should be. The third is, it's often a moral circumstance. Insurance makes you cover things like abortion, birth control that you might not agree with, transgender care. These organizations are very clear what they don't cover. They're really about ending up in the hospital or having an urgent need like a surgery. Some of the challenges that we'd also want you to look at, especially before you sign up, is that if you have a pre-existing condition, oftentimes those aren't covered for several years. And so you want to understand what that means. Secondly, if you have a chronic condition or a condition that becomes chronic, that'll become your responsibility after the initial episode. And that is something we help with and we help guide people through, but you need to know it's not covered under these. The third is, when you do have a health event, you do need to prepay for it. So like my son-in-law just had emergency surgery, he's going ahead and paying for that, and then the health share is reimbursing him. Why do we think this is great? Well, really, when we think about the care that you get at Story Family Medicine and the care that the health shares cover, there's no overlap. They really bless each other and they really work well together. So I'd encourage you to look at them.